Maria is here for a routine diabetes visit, blood pressure, HbA1c, diabetes and other medications refill. It has been more years since her last eye check. She feels fine, no blurry vision, no pain, no warning sign. But that is exactly the problem. Diabetic retinopathy can be silent early, and if it is missed, it can eventually threaten vision. But how do you bring specialist-level retinal screening to the patient who is already sitting in primary care? In this clinic, there is no ophthalmologist in the room. A medical assistant takes 2 retinal photos. The images are uploaded. A screen says, "Analyzing." Then, within minutes, the software gives a result. Diabetic retinopathy detected. Refer to an eye care professional. No eye doctor interpreted the image. No radiologist read the scan. The AI made the screening decision. In 2018, the FDA authorized IDx-DR, now known as LumineticsCore, to automatically detect more than mild diabetic retinopathy in adults with diabetes who had not already been diagnosed with diabetic retinopathy. In the pivotal study, 900 participants were enrolled across 10 primary care sites. The reported sensitivity was 87.4% and specificity was 89.5%. That is why this case matters historically. It was not just AI helping a doctor, it was AI completing one narrow screening interpretation step without a specialist also reading the image. But the word narrow is doing a lot of work here. The AI was not giving general medical advice. It was not answering patient questions. It was not diagnosing chest pain, dizziness, cancer, sepsis, or depression. It was not even diagnosing every eye disease. It was answering one specific question: does this diabetic patient's retinal image suggest more than mild diabetic retinopathy, requiring referral? That is the difference between replacing a doctor and replacing a task. The ophthalmologist was not removed from eye care. The ophthalmologist was removed from the first image interpretation step. But there is a catch. A negative diabetic retinopathy screen does not mean your eyes are fine. It means the system did not detect the disease it was designed to detect. It is not checking visual acuity, cataract, glaucoma, macular degeneration, eye pain, or the rest of the patient. And the FDA documentation is explicit. The device should not be used to screen for diseases beyond its indicated use. Follow-up care is critical, and the device does not treat disease. This is powerful because it is narrow. It is also limited because it is narrow. So, are doctors already being replaced by AI? In one sense, yes, a specialist interpretation task has already been automated. But in the broader sense, no. The future is probably not one giant AI doctor. It is many small, regulated, task-specific systems embedded into clinical care. And the real question is not, will AI replace doctors? The better question is, which clinical bottleneck should AI remove next?